And to Nasarawa, where the government is still tracking contacts of a member of the State Assembly that died due to complications from the coronavirus. The Speaker and other members are already observing self-quarantine, while a 24-hour curfew has been imposed in the state by Governor Abdullahi Sule. He joins me now for more on these developments. Good to have you join us, Your Excellency.
Thank you very much.
Let me start by offering my sincere condolence to you and the people of Benue State for the loss of the lawmaker representing Nasarawa Central, Honorable Suleiman Adamu. Now, what more can you tell us about efforts at contact tracing and the results from samples collected as a result of his painful death?
Yeah, so far we have collected the samples of all the members of House of Assembly, 23 of them who are currently isolated. We have sent the samples 3 days ago for testing. We have identified all the 74 contacts. We have taken the samples of first the 10 closest members of his family, in the first day. As at yesterday, we took another 25. As of today, we are taking more, so we are hoping by tomorrow we will be able to complete that. We have totally locked down Nasarawa as a local government. That way it will give us opportunity to move around and see other contacts. We have identified additional contacts to the 74, and we are also following them to take their samples so far.
All right, so Nasarawa has only recorded about 11 or 12 cases, but you're bounded by Kaduna State in the north that has about 85 cases, and in the west by the FCT with about 316 cases. So what are you doing to curtail the spread of the virus in your state and then incursion from other states?
Well, before even the lockdown of borders, between the states, Nasarawa was the first for the same reason you have just mentioned. The moment we realized that the case FCT was becoming really an epic center, we decided to lock down the border between the FCT and Nasarawa State. And the same we have done with Benue. We did also the same thing with Taraba State, with Plateau and Kaduna States. So we did the same. We have locked down those borders. We have also completely banned the use of motorcycles because they use these to carry people around. We have identified all the isolation centers and now what we are calling holding centers. The holding centers are where we are having returnees, mostly from these other places, Lagos, Kano, and sometimes even the FCT. The moment we realize that somebody's position is showing any kind of symptoms, we take them to those holding centers and we take them to the center. But because we are having another situation at hand of the ALMAJIRIS, so for instance, in one of the holding centers, we have over 100 ALMAJIRIS that we receive actually from Bauchi State that we are holding there. And we tested them, and so far, every one of them that we tested, we received their results, they are negative.
All right, so because you mentioned the ALMAJIRIS, there was a situation between your state and Taraba State where they're saying some of the ALMAJIRIS, you returned to them and not from that state, but you're also dealing with that situation in your state. So how are you handling that situation?
No. There was a misunderstanding on that one. As a matter of fact, the Taraba State, the governor is indisposed at the moment. So we were having some problems communicating with them. They didn't just take the ALMAJIRIS to Taraba. They had actually taken ALMAJIRIS to about 5 states on the same day. And all the other states, starting from Plateau, Yobe, Adamawa, and others, all received the ALMAJIRIS. But when they went to Taraba, because there was no proper communication, they didn't want to take the ALMAJIRIS. And I told the buses to turn around and come back. And I think that's where the press pick up their information. But before they even got back to Wukari, the governor came on board and asked me. And I said, yes, sorry, we couldn't get in touch with you. He said, oh, sorry about that. Bring them back. So we brought them back, and Taraba has already connected them. And we have continued by taking some to Jigawa, to Kaduna, and other places. And it has continued very smoothly.
Okay, they also said that, or they alleged that no test was conducted for these ALMAJIRIS, or there was no test showing that whether they had the coronavirus or not. Do you conduct tests for these ALMAJIRIS before you return them? What is the procedure?
No, as for the ALMAJIRIS here in Nasarawa State, we don't have a testing center. And most of the people, you see, they fall into the three categories of what the NCDC are testing. These Almajiris are not traveling from any of those states that we have mentioned of high risk. They have not come in contact with anybody. They have not. They are not showing any symptoms. So for that reason, we don't test people who are outside any of these three categories. But what we do is that we check them. Are their temperatures okay? Are they showing any signs of the COVID-19? If they don't fall into any of those categories, what we do is to make sure that they enter into the air-conditioned buses, which we provided, and we give them the face mask to protect themselves. And they sit very far apart from each other to maintain the social distancing, and we have sent them. A good example is what the governor of Kaduna has said yesterday. Of the over 100 he received from Nasarawa, there was none any. They have tested them because they have a testing center in Kaduna, so they have been able to test them, and they didn't find any one of them with this. And the ones we receive also from Bauchi, we send their test samples, about 40 of them, and so far they all negative. There was no problem. So this is between a low risk and a low risk area. Nasarawa is still considered low risk because, as you mentioned, even with the challenges of FCT and Kaduna, we are still just around 11 or 12 positive cases.
So let's look at the challenges some other states are facing. For example, we're seeing people break out of isolation centers and complain about the welfare at those isolation centers. We're also seeing how the welfare of health workers are not put into place. For example, we're seeing the high infection rate among health workers. So how equipped are your isolation centers, and how prepared are the health workers in Nasarawa State for this outbreak?
It took a very long time before Nasarawa had our index case. So, and our deputy governor happens to be a medical doctor. So, number one thing we did in Nasarawa, even before the isolation centers were ready, is the idea of training. We kept training these medical personnel who will be handling this, training some of the security people who will be around that. So, we provided a lot of training. So far, over 80 personnel had been trained, from the information we received. And we are operating only about 4 of our isolation centers have people there, have patients, there. And some of them are waiting the results. So I think the training has helped a lot. And the fact that in Nasarawa State, we shut down most of our own operations. We are one of the first states actually to shut down our borders, the moment we realized the situation. At the time, we didn't even lock down the state, but we shut down our borders, and then we maintained some medical personnel at the borders and some security people at the borders to make sure they are checking everybody. We consolidated the motor parks at the time into one place. Every major city like Lafia or Kefi, we concentrated into one park, and everybody coming in was that. We carried out the campaign and the awareness much earlier of washing of hands, making sure wearing your mask and the rest of that. I think all those help us. So, but when you talk about the welfare of some of the people at the isolation centers, a lot of some of these people are very difficult to handle. And I feel sorry when I see the one mentioned in Gombe State. The reason is because these people, a lot of them come from places like Lagos that have total shutdown. So if somebody has the capacity, to move out of Lagos, pass Ogun, Ocean, Oyo, and all these places, Kwara, to come all the way to Nasarawa State, you can understand the level of discipline of such a person. And so they take the slightest opportunity, just to complain about, no, the food has not come on time, no, the food is not enough, no, that, because nobody wants to keep anybody at the isolation centers. It's just because the situation warrants that you should protect also the rest of the people.
Your Excellency, if I may come in here, we hear that the pandemic has affected the payment of local government workers. So are you considering easing the lockdown in your state to allow for business premises to reopen due to the fact that some persons in that state depend on their daily income to survive?
In Nasarawa State, we didn't lock down businesses completely. But for instance, a lot of the people in Benue, in Karu, they live in Abuja. So for the fact that Abuja was locked down, even if you allow them to go for their daily bread, there was no place for them to go for that daily bread. And I think those are the kinds of things that happen. Now, yes, the COVID-19 has caused a lot of challenges when it comes to the economy. you know, and this is global economy for that matter. And God forbid, but it's going to look worse, you know, the moment for places like Nasarawa, because Nasarawa relies heavily on the on FAC, on Federation Allocation Account. And so with the oil prices going, with our inability to sell oil, with the rest of that is going to be that. So that is the effect that I think we are seeing in the local government area. But it's completely different from people going out for their daily bread, with the exception of shutdown of some of the markets and the rest of that. You know, we have not shut down the lockdown Nasarawa as a whole. We have not done that.
Thank you so much, Your Excellency, Governor Abdullahi Sule of Nasarawa State, for talking to TVC News.